Hi, this is your Antepartum video lecture number 2, discussing primarily physiological adaptations to pregnancy. The first thing we're going to be talking about is the integumentary system, which primarily is what happens to our skin during pregnancy. So circulation to the skin increases 3 to 4-fold during pregnancy. So thus there is increased sweat glands and sebaceous gland work. This helps dissipate heat produced by the increased metabolism. So pregnant women feel warmer and perspire more, especially in their last trimester. So the increase in the sebaceous gland activity promotes development of pimples and blemishes and acne. You're going to see hyperpigmentation. We had mentioned that just in the last video lecture, and that's related to increased levels of estrogen, progesterone, and the melanocyte stimulating hormone. Women with darker hair tend to exhibit more changes like moles, along with areola and freckles darken, and that's called chloasma, which is also referred to as the mask of pregnancy. A lot of times that involves the forehead and the cheeks, and about 45 to 70% of pregnant women experience this. It can also occur to women who are not pregnant who are on birth control pills. It increases with sun exposure. Hyperpigmentation usually disappears as hormones start to diminish. So you'll see, again, linea nigra, which is that line that goes all along the abdomen and all the way around up the back. You'll see that as well. Because surface vessels dilate related to estrogen, they are more apparent. Angiomas, which are those vascular spiders, you'll see a lot on your hands, look like tiny red elevations branching in all directions and occur most often in the face, neck, upper chest, arms, and legs. You might see redness of the palms or the soles of the feet. And that's called palmar erythema. Striae gravidarum, which is stretch marks, occur in about 50 to 80% of women. They are linear tears in the connective tissue. Most often you'll see those in the abdomen, the breast, the buttocks. They look slightly like pinkish to purple and then fade to silvery lines after pregnancy. You might see some hair loss. That typically occurs in postpartum period and can be increased for about 2 to 4 months. The next picture just kind of shows you that mask of pregnancy and that linea nigra. Then we move on to the respiratory system. So oxygen consumption, as it says on your PowerPoint slide, increases about 15 to 20% during pregnancy. And that's due to the fetus and the placenta, because what happens is that there's more blood volume going through, okay? As well as increased demand on the maternal heart and kidneys. You're going to see hyperventilation, like a pregnant woman, she gets further into pregnancy, she might hyperventilate a little bit, and that's due to progesterone, because what happens is it increases the depth of respirations while the rate stays primarily unchanged. Oxygen changes result from 3 things: hormonal changes, increased oxygen consumption, and the effects of the growing fetus. One of the things that you might see, and this is due to estrogen, it causes vascularity of the mucous membranes of the upper respiratory tract. So you might see like some frequent nosebleeds. You might see the voice deepen a little bit. And that's because of just the engorged capillaries that are involved in that. Now, cardiovascular changes, there's a lot of things that go on with that. So cardiac output, it increases not by a little, by a lot, almost like 50%. Heart rate also goes up about 15 to 20 beats per minute. Total blood volume increases by 40 to 50%. And this results from the enlarging heart, the increased cardiac output, and decreased peripheral vascular resistance. Okay, you're going to see an increased white blood cell count. 9 to 15 is considered normal in pregnancy, so it doesn't mean a woman is sick or she's having an infection. You're going to see rises in clotting factors like fibrinogen, fibrin split products, PT, PTT, some of the factor. And what this does is kind of prepares the woman for her bleeding afterwards. So it makes them hypercoagulable, but it also is that buffer for when you're in labor and when you deliver. Now, when you're hypercoagulable, it makes you at an increased risk for DVTs. So, again, if anybody has a history on that, they'll probably have to be on some kind of medication for that as well. Temporary changes in heart sound are common in pregnancy. You might hear a systolic murmur, but that should change afterwards. Blood pressure doesn't really change. It may initially, and then it goes back to normal. And it really shouldn't change unless you have some kind of illness like hypertension or preeclampsia. One of the things that I want you to remember too is physiologic anemia, which is due to hemodilution. Because the volume of the RBCs is considered in proportion of the blood volume, the increased volume over the red blood cell count results in hemoglobin and hematocrit values to suggest anemia. So that's why we call it hemodilution. And what that is just that plasma increase exceeds the RBCs. So that happens a lot. So a normal hematocrit in pregnancy is like 33 to 39, and a normal hemoglobin is 11 to 13 in pregnancy. One of the things I want you to remember is that the pregnancy places increased demands on this particular system. Dependent edema, varicose vein, hemorrhoids are all caused when the iliac veins and the vena cava are compressed, causing increased venous pressure and decreased perfusion to the lower body. Okay, so that's kind of normal. There's another thing I want you to remember, and that's called supine hypotension syndrome. So that's why we never want pregnant women to lay flat, because the weight of that gravid uterus is pressing on the vena cava, which is going to cause decreased blood pressure, can cause bradycardia, fainting, and possible fetal heart rate changes due to decreased perfusion. So again, that's why women should never be flat in bed. Okay? Some of the urinary systems, what changes with that is there's some changes because the kidneys change shape. Blood flow increases by 80% during pregnancy because of that volume, and because of cardiac output and volume, and because of this, the GVFR increases by 50%. The glomerular filtration rate is the rate at which blood plasma filters through the kidneys. So because we talk about that increases, we talk about women to spill small amounts of urine due to changes in that tubular function, and it's normal in pregnancy up to 20 weeks. The other thing too is you're going to have urgency and frequency, and it doesn't mean you have a UTI. It's just due to pressure on the bladder. Okay. Progesterone decreases the bladder tone, and it causes all kinds of changes in the kidneys and ureters. There is an increased risk of pyelonephritis because of pressure on the ureters, and this happens because of the change of the shape of the kidney. Nocturia is very common in pregnant women because sodium and water are retained when a woman stands up, and then and it's excreted at night. Okay, so of course when she gets all comfortable and puts the pillow in between her legs, then what she has to do, she has to get up and go to the bathroom. So it's beautiful being pregnant. Some of the musculoskeletal changes is, your pregnancy is characterized by changes in posture and gait, and additionally weight gain strains your joints. So during pregnancy, the need for calcium increases, and it is stored for fetal use. The round ligament comes around your abdomen, and this actually stabilizes the uterus, but when it's stretched, it causes pain, and this usually happens for our first-time moms. At about 28 weeks, the pelvis symphysis starts to separate because of that increased mobility of the pelvis, and that's when that waddle is born. So when you see the women kind of waddle, but also as a woman gets bigger, her center of gravity changes too. There's some things up in your PowerPoint that talks about lordosis, which is changes. These changes are gradual that you can see on like in the picture. You'll see in your book it talks about. Look, you can see like the curvature of the spine. Relaxin and progesterone are two hormones that actually start to take shape as a woman comes in labor, because it actually kind of relaxes like the pelvis and the surrounding tissues and the pelvic floor so that the fetus can descend and be born. So that's kind of cool. GI system. Unless nauseated, most women experience an increase in appetite in pregnancy that helps her consume sufficient calories to maintain the pregnancy. Your book talks about whether it's unclear whether or not gastric emptying is slowed in pregnancy. We tend to think it's slowed anecdotally. The intestines take longer to empty, so there's additional time for nutrient absorption, which could benefit the fetus. However, that leads to bloating and abdominal distension for mom, bowel cramping, uterine contractions, displaced intestines, compression, all of that. It's just a great thing. Estrogen causes hyperemia, so sometimes your gums are swollen and bleed, increases dental plaque. Progesterone and estrogen is probably always a good choice because it's the culprit for most things. Heartburn, flatulence are very common, so is constipation. Again, you want to just be careful with that. The relaxation of the cardiac sphincter allows for reflux, which causes heartburn. So over-the-counter acids or antacids like Maalox, Tums, all of that. Again, you should, contact your healthcare provider for that. We're seeing increases in gallbladder issues during pregnancy, and I think that could be due to a lot of things. It could be due to our diet, it could be due to our lack of exercise, and it could also be due to, the decreased muscle tone and emptying time and thickened bile. Usually, as far as like the discomforts of pregnancy, which we'll talk about later, but one of the things they're talking about here is that, the nausea and vomiting in pregnancy, which really kind of happens in the first trimester usually. They're unclear on why exactly this does happen, but a lot of it is due to increasing hormone levels, like HCG is just one of those things. Now, some of the physiological adaptations to the reproductive system. Obviously the uterus grows phenomenally in that first trimester due to estrogen and progesterone. The muscle fibers stretch in all directions. The uterus grows because of increased vascularity, the dilation of the blood vessels, hyperplasia, and then the growth of the fetus. So at 7 weeks, the embryo is like the size of a hen egg. At 10 weeks, it's like the size of an orange, and at 12 weeks, it's the size of a grapefruit. As the uterus grows, it changes shape as the fetus grows, and it rises gradually outside of the pelvis, and usually takes about week 12, week 13 to get out of the pelvis. We'll talk a little bit later about how we can check fundal height. The uterus, so I says it rises gradually and then decreases around 38 to 40 weeks as the fetus descends back into the pelvis, and that's what we call lightening in preparation of the birth. At around the 4th month, like around 16 weeks or so, usually Braxton Hicks are a little bit more noticeable. And those are those irregular rehearsal type contractions that you might see. Placenta perfusion to the uterus is 1/6 of the total maternal volume flow through the uterus at about 400 to 650 milliliters per minute. Oxygen consumption increases greatly to meet the needs of the fetus. The cervix is going to start taking change too. The Goodell sign, which is the softening of the cervical tip that might be seen as early as 6 weeks. The ballotment, vagina, vulva, Chadwick sign, leukorrhea, which is that white discharge that is formed due to the stimulation of the cervix by estrogen and progesterone. This discharge fills the endocervical canal, and that's how the mucus plug is formed. Increased acidity to the vagina prevents some infection, but it's vulnerable to others like yeast due to high glycogen-rich environment. Breast, we already talked really about the breast. Colostrum is that, we call that liquid gold. It may leak as early as 16 weeks. And I think that is it for this video. These are just the physiological adaptations, and we'll stay tuned for the next one.